Okay, we are doing our discharge teaching for COPD on our patient Asper. Asper has been diagnosed with COPD during his hospital stay, and we are going to brief him on his discharge orders for going home. Hello, Asper. I am Melissa Bangert. I'll be your nurse tonight, and I'll be briefing you on your discharge papers. So we're first going to go over your diagnosis of COPD. COPD is a disease that is characterized by a combination of asthma, emphysema, and bronchitis. It can cause difficulties with breathing, such as dyspnea. As the disease progresses, it gets harder to breathe on your own, which is why we're going to address it with a few medications. The first medication we are going to prescribe and send you home with is oxygen. We're setting that at 2 liters. One question I need to ask with the oxygen is if you currently smoke. Okay, you quit a year ago. Alright, that's good because smoking can make COPD worse. The other thing to keep in mind with using oxygen is that you can't wear any wool clothing because it can cause static electricity that can interact badly with the oxygen. I also see that you are on a beta blocker that is non-cardioselective. So we're going to switch you to a cardioselective beta blocker such as metoprolol because it can interfere with the third medication we'll be prescribing, albuterol, which is a bronchodilator that can help you with breathing. We're sending that home as a nebulizer treatment. A few things to know with albuterol: it's not a rescue inhaler, so if you run into difficulties breathing, you can't use it as rescue inhaler and should call 911 immediately. And the other thing with the albuterol is it can raise your heart rate. So if you feel dizzy after a nebulizer treatment, sit down until the dizziness subsides. Cases in which you should call 911 is if you are experiencing difficulty breathing that the nebulizer treatment doesn't help with, or if you're in a position that we call tripoding. So when you tripod, it looks like this, and that means you're going into respiratory distress and you should call 911 or have a family member call 911 if you can't. Do you have any questions for me? No? Okay. If you have any more questions, just let me know or let the doctor know.